Hi everyone. Hope you're excited for the live Q&A with Dr. Alex George. But just quickly, a brief intro about Alex. So Dr. Alex George is an A&E doctor and originally rose to fame on the Love Island show of 2018. And since winning over the nation then, he's gained over 1.5 million followers while working in A&E. Over the following years, he's worked as a resident doctor on GMB in Lorraine, presented for Watchdog, appeared on Celebrity MasterChef, and all this while, Alex has his own podcast called The Waiting Room and a rapidly growing YouTube channel. He's also a fully qualified level 3 personal trainer, and across all these platforms, Alex has become a leading voice in mental and sexual health and uses his platform to make health and medicine more accessible to millennials and beyond. Since the outbreak of COVID-19, Alex has become an icon amongst the healthcare professionals in the UK, bringing the nation accessible and reassuring advice directly from the front line as an emergency doctor from Lewisham Hospital. Please welcome Dr. Alex George, everyone.
Hello.
Hi, Alex. Nice for you to join us. Thank you so much.
Hi, Rashad. Thank you so much. Very kind introduction. And thank you to everyone that's joining in this and listening to this. I really enjoyed Chris's talk just earlier. I've got a hard act to follow, I think. I actually feel quite inspired myself. So thank you so much. And thank you to everyone that's joining in and listening to this.
Yeah, I'm sure everyone's waiting to hear from you as well. Great. So just an easy question to start off with that I'm sure you've got hundreds of times. When did you first know that you wanted to be a doctor?
Yeah, it is. It's one of those questions we all get asked, isn't it? It's like, well, when did you decide? Like, when did you realize that golden journey, I guess? I think for me, I think it was the fact that when I was younger, I kind of enjoyed science. I like people. I liked a bit of drama as well. I think you've got to like a bit of drama to become a doctor because, you know, it's people. It's not just about science. And I think when I was kind of younger, I used to watch like City Hospital and some of the other kind of early shows that are very similar to 24 Hours in A&E. And I think they were like very exciting, very cool. I like the idea of working on the frontline A&E and I just was really inspired by it. And no family that are doctors. I think probably similar to a lot of people these days. It just seemed like a really interesting career. So I thought, why not?
Yeah, of course. Yeah. When you finally did get into medical school, what was your experience like?
I really enjoyed medical school. I'd say that one of the things I hope that I can share during this talk is a little bit about how sometimes life doesn't always go the way you want it to. And sometimes getting to your destination per se isn't always the easiest journey. And actually, when I first applied to medical school, I had a place at Liverpool. And when it came to A-level results day, I missed out on my A in chemistry by 2 marks, which was gutting. They dropped me on my coursework, so I was pretty devastated by that. And essentially, they wouldn't accept me at that point. So I had to go back to scratch, get my 2 marks in my coursework and reapply the next year. So it wasn't the easiest, most straightforward journey, but I was glad that I did that. It was a really good lesson actually in my life because I learned a bit about perseverance and, you know, being in some way relentless, you know, not being afraid of failure and kind of moving forward. And when I went to med school, you know, I absolutely loved it, maybe even more so because I nearly didn't get in. And, you know, I tried to make the most of every moment. Freshers was brilliant, as you can imagine, and kind of moving through the years, I just really enjoyed it. I think, you know, there's times that are really stressful, exams and all that. And sometimes you'll have a placement where you're with a consultant that's maybe not the friendliest, but, you know, on the whole, with the ups and downs, meet amazing people. You know, I really enjoyed it.
That's really good. And I think that sets a great example as well for our freshers to learn that when you do encounter failure, it's not the end of the world and you can still make it as you have.
Yeah, I think it's in life you learn much more from your failures than you do successes. And I think what I really learned, that failing is kind of sucks sometimes. But also I learned that even if you were knocked back, I could pick myself up and I'd move forward. And actually, you know, when I was younger, at least, when I look back into my kind of school years, I was undiagnosed dyslexic. I probably learn in a very atypical way. I don't learn very well with writing. I've got terrible handwriting. Don't engage in probably traditional schoolwork as well. And I thought, well, how am I going to do this? You know, and I had a lot of teachers tell me, oh, you're not going to make it to med school. You know, shouldn't even try. And when I got in, actually, the kind of the way of learning at medical school, the kind of practicalities of it, as well as learning through kind of visual or other formats, really worked for me. And you know, all of a sudden, my grades and everything were absolutely fine. And I if anything, I flourished at medical school. So don't feel, I think my message would be that don't come into med school thinking, oh, am I going to be good enough? Will I do this? You'll always find your own way. You'll find your own interests. And, you know, as long as you persevere and don't give up, you'll always get there.
Yeah, and I think trademark of any doctor is bad handwriting. So you're not too far off there.
Exactly.
So you mentioned you had a great time with medical school. Do you have any highlights that you could share with us?
Yeah, I have some. I think of both really. I think highlights probably. I really enjoyed. And it's kind of a sore subject at the moment. I get with the pandemic. And I just want to say as well, I have a huge amount of respect to all of you. You know, going through med school at the moment, even starting medical school. You know, it must be really challenging. And I just want you to know you're a part of history in a sense, and you know you will get through it. I mean, it's a difficult start, but I think as was mentioned earlier. You know, it's 5 years at med school. You've got plenty of time to have nights out and enjoy a bit more. So don't panic about that. Highlights. I really enjoyed kind of placement. I think for me, like my favorite part of being a med student was being on placement. I enjoyed like meeting patients and feeling that I was like developing. And every year, I think as you go through it, you feel like you're gaining more and more confidence. I think as Chris was saying, by the time you're in kind of 5th year, you feel, oh my gosh, I'm nearly there now. I'm nearly a doctor. But the one thing I would say to people, and I hope that I can get this across, you know, in this talk that we're doing, is that it is much more for me, I think, about enjoying the journey than it is getting to your end result. I look back on, I went to med school in, was it 2010? So it's kind of a 10-year decade of looking back. And I think you often, medicine and training and med school and then postgraduate training is always about getting to the next step. And I think that's one massive fundamental flaw in life in general, I think, is constantly looking to that next step. In my opinion, you've really got to enjoy the moment you're in. I think I was as happy and enjoying myself as much as a first year med student as I am now, with all, working in A&E and doing the things I'm doing. Enjoy the journey, enjoy each moment. Don't always rush to that next step. And I think that for me would be my main kind of tip at medical school in terms of just making the most of it. Just enjoy it. When you're a consultant, you look back and go, I wish I was back in freshers again. So don't rush, enjoy it.
No, 100% agree with everything you said. So you mentioned about freshers starting their careers now. Do you have any specific advice for them because they don't have access to placement and things in the same way that we have?
Sorry, in terms of starting.
Starting medical school during a pandemic, it's not ideal, is it?
It's not easy. And again, I absolutely take my kind of hat off to you. I think you're all really inspiring in doing it. One thing I first would say is that you are part of something that's, it is history. It really is. And there's a lot of negatives, but a lot of pros as well. You're actually going to learn about how we deal with a pandemic. I mean, one experience I didn't learn at med school about living through and dealing with a pandemic. You can get involved to an extent. And I know that we are having the King students back at Lewisham now. And I've been teaching this week in A&E with the students and getting them involved, getting them in the PPE, and actually being involved in the pandemic rather than feeling that you kind of pushed aside. So I hope that's the experience most people will have the next few years. I think very importantly, looking through this time, your mental health is the key thing. When I was at medical school, I think it was 4th year, I was placed down in Truro. So I went to Peninsula Medical School at the time, which is Plymouth and Exeter, and we had a placement down in Truro. And I spent a period of time down there, but I actually got very isolated. I kind of was away from most of my friends that I'd formed. My family lived in Wales, and I'd let things like exercise slip. I started eating badly. I didn't really socialize, spent a lot of time in my room. And I kind of got myself into a bad kind of mental state, I think. And I was far too worried about speaking to anyone, especially in that, even I think at that time, which is not that long ago, it was kind of very, well, can I say that I'm struggling? Can I tell the med school that I might want some help? And so it took me a real while to realize that. And eventually I actually spoke to my own mum. And together we kind of, I kind of said, look, I'm struggling. And we kind of worked out a plan. We spoke every day. I started exercising, doing all the good kind of lifestyle things that we know really, really work towards mental health, eating well as well, of course. And things got better. But I really reflect on that now, on my journey in medical school, and think, well, why did I stay silent so long? I could have been better so much quicker if I'd have reached out. So what I would say during this time in the pandemic is, as Chris said, reach out earlier, and sooner, before things are difficult. I left things way too late to ask someone, and there's no shame at all of struggling. We all go through life having good times and bad. I have never to this day, and I've met a lot of people either professionally in different circumstances through working through TV and A&E and just general life, I've not met a single person so far that's been happy every day of their life. I certainly have not met a doctor that's been happy every single day of their life. So we can all accept that no one is perfect in their mental health. And therefore, if you are struggling, do speak, reach out, talk to people how you feel. And the other quick point I'd make there as well, people worry about kind of, will I be discriminated against for mental health? You will not be. There's no such thing on the application of form for your FPAS saying, yeah, you get knocked down if you've reached out or struggled with mental health. That's no longer. I hope it was never the case. It certainly isn't the case now, and it shouldn't be a reason that you don't reach out. It does not stop you from being a good doctor. And I've met a lot of doctors along the way who are really, really amazing, top people at their job, and they are very open about their struggles with mental health. So that's an important point.
Yeah, agreed, completely agreed. And the BMA has a great well-being service as well that I would encourage anyone who's going through any problems to go to.
It's 24/7.
Sorry, yes,
it
is 24/7 and free to use whether or not you are a member. So please do reach out and don't suffer in silence. Just quickly, I just want to talk to you about because you mentioned mental health and well-being. Do you have any specific advice for those who can't reach out or don't have the resources to reach out? And how would you say to maintain their well-being in tough times like that?
Well, first of all, I'd say that, I hope that everyone and anyone can reach out in one way or another. Of course, your well-being service actually seems, a really good place to start with that through the BMA. But of course, you've got through university, you will have support from tutors and a dedicated service to reach out to your family, your friends. I mean, I spoke to my mum. I think speaking to your mum sometimes is one of the best things you can do, but I appreciate that's not always the case. I'm not saying that is the be all and end all. But what I really mean by that is find the person in your life that you feel that you can talk to. And don't forget as well, when you go to med school, wherever you all are, make sure you register your GPs. Please do. If everyone's listening today, you must be registered to your GP. I made the mistake when I went to med school. And then when I needed something from the GP, I was like, I don't have one. It's a problem. And especially during the pandemic. And of course, they're a great place to go and speak and ask for help. In terms of looking after your mental health, the thing that I would say, and I think a frustration of mine, certainly when I was at medical school, and I don't think it was focused on enough, is how important actually lifestyle factors and how important what we do in our lives actually plays a part in our health, physical and mental. We learn a lot about pathology. We learn anatomy, physiology, and pathology quite a lot, and diagnosis, treatment, surgical plans, all this kind of stuff. But sometimes I think we miss that really important step that actually what we do each day really does impact in our body and our mind. So, what we eat, we know so much more now about the gut-brain axis, the idea that of what you actually eat and what you do in terms of looking after your gut does impact your mental health. The idea that obviously it's been talked about in the past about exercise, but exercising outdoors and having time each day outdoors is massively helpful for mental health. The importance of forming good relationships and bonds with people, in your life as well, so that you can actually get support and speak to people. So just have a look at those little things, those little changes you can make, the getting into good routines, the good habits that support your mental health is super important.
Yeah. And honestly, you've been through a really tough time recently, having lost your brother to mental health. I just want to ask, and like I'm so in admiration of the way you've used your platform to talk about mental health. So would you tell us more about how you've done that and what you want to
Yeah,
tell?
I mean, look, it's. I think it's the idea that mental health can affect, anyone, isn't it? In my opinion, it's not 1 in 4 people affected by mental health. It's everyone. We all go through good times and bad. Obviously, losing my little brother Theo to mental health has been very tough. It's been tough as it is. The pandemic's been hard. I work in A&E in Lewisham. Lewisham was one of the hardest, kind of top 5, probably hardest hit hospitals in the UK. We were hit very early. I think we saw. We had little clinics or hubs set outside the hospital that we were first swabbing people back in, must have been mid-Feb. And then it quickly, transformed into what the pandemic was with, a huge number of cases. We were intubating, God knows how many a day, like 10, 15, 20 a day, in recess. And that was a huge pressure. And then, of course, coming out of that, I thought things were on the, life was on the up. And then obviously, what happened with Theo, he was 19. He actually had a place at Southampton Medical School. I don't know if there's any Southampton med students here, but he actually had his place. But sadly, for a number of factors that, are potentially some of them are unclear, he took his life. And that is difficult to accept and to take. But it kind of inspires me in some sense to try and, lift this conversation around it and realize how important actually looking after your mental health is. Like if you're at medical school and you're trying to learn and be a really great doctor, if you're not looking after your mental health, you're not going to get the most out of your studies, let alone the rest of your kind of life. And I'm trying to bring that into schools. So the idea of getting a real established curriculum around mental health teaching and support and counselling at schools, and also, at universities as well. So it's been a tough time, but I think, we all have a role and responsibility to look after ourselves and others. So, I'd say to people, if you think anyone's struggling at medical school, some of your colleagues, I like the ask twice idea. You ask, how are you doing today? Rishabh, how are you today? And yeah, mate, I'm fine. But then I go, maybe a bit later, or if you get the sense of something, or, even at the time saying, how are you actually doing? Like, are you okay? Is everything, going all right at the moment? And then you go, actually, I'm struggling with this. And that one opportunity for someone could give them that invitation they need to share what they're feeling. So I think we all have that role and responsibility.
Yeah, I think that's a very powerful message. Thank you for that. I'm so sorry for your loss, and I'm so happy that you've used that as such a positive way to help us all. So thank you for your contribution now. I've got a great question here from Roham Karimi. It was Amira Hussain, sorry. And she asked, as a doctor, do you think we learn enough about mental health on our course, or do we focus too much on physical ailments? And how do we change this?
How do we change it? I think that's a brilliant question. And the honest answer is yes, probably. I think certainly historically, I think mental health was kind of, I've heard of it described as the Nightingale idea of kind of in healthcare. So the idea that kind of it's not maybe focused on that much, is kind of there but never really given its full attention. I think that actually reflects society potentially over the years and how we've viewed physical health and mental health. But I think you can't have one without the other. And this is what I'm really trying to talk about these days. If you think about it, if your physical health is poor, maybe you've got heart disease, heart failure, not able to go outside and walk in the countryside as you normally like to, it'll affect your mental health and you feel worse, right? If your mental health's poor and you're low, you lack energy, you're not sleeping well, you're probably not going to go outside and exercise, or you might not eat as well as you normally would, and that'll affect your physical health because you might end up with diabetes or blood pressure issues. So I think it's so interconnected that you can't pull it apart. And the same preventable factors, we go, right, how do you prevent, MIs, right? Well, make sure, you don't have a too high BMI, make sure you don't smoke, avoid these things. All of these factors that help one part of physical health also contribute to our mental health. And it's all a state of being, I think. And another way to look at it, even if you think of it this way, if someone's chronically stressed, they've got higher levels of inflammation in the body, they're likely to have blood pressure issues, they might have chronic high cortisol levels. That causes physical issues as well. Do you know what I mean? And it can come from mental health. So I think it's very important. I'm glad to say I think that we are getting there. We're changing our attitudes around that. I'm sure at med school that's happening as well. the thing I would say that the one thing you can do as students is to talk about it. Actually, is to try and create further conversation around it and start giving it that focus that it deserves. And I think when you guys do that, it will become more powerful. I think the other thing as well, I think Chris said as well, is that you guys can make change. It doesn't have to be consultants or heads of public health that do it. You can say at this med school, well, actually, I think we should be focusing a bit more on this or this or this. So you guys can make change.
Yeah, agreed. I've got a lot of questions here about your career as a doctor. So what did it feel like when you first qualified as an F1, and what was your first day like?
Yeah, so it was really scary, to be fair. Like, I think anyone says they start their first day breezing on, like, it's nerve-wracking, but that's good. Nerves and feeling a bit anxious in the right settings are good. And starting as an F1 doctor in your first day is a reasonable time to feel a bit anxious. So I graduated from Peninsula Medical School in 2015, and I went to King's College Hospital for my first placement, and I was on the acute medical ward on my first day, and I was terrified. I forgot what dose of paracetamol to prescribe on the first day. And I was like, what? I don't even know what I'm doing. But what I would say to everyone is, honestly, you are not thrown into the deep end as much as you think. You are honestly really well supported. And I think that's fair to say from the top. And actually, people will help you. The old adage of nurses will help you. They really, really well. If you're really nice to them and say, oh, what is this the right dose of this or whatever? Can you just check this? Or does this look right to you? They'll help you. And you do get through it. And actually, I loved it. And actually, when I got through my first day or so and my nerves had calmed down, I didn't even want to leave work. I know it sounds a bit geeky now and stuff, but I absolutely loved it. The year was busy. It's hard. Like, I was on a 1A band. I don't know what you call it now, but a 1A banded rota as an F1 for 4 years for general surgery, acute med, and care of the elderly. So it was busy on calls, night shifts, weekends. But I learned so much, and you adapt. And by the end of the year as an F1, you feel so much more rounded, and you think, I really am a doctor. I'm ready to move on, as an F2, as an SHO, which is great.
Yeah, that's really good. We've got another question from Holly Egan here. How was the transition from medical school to junior doctor? Was it a big jump?
Thanks, Holly. I actually think it's not as much as a transition as people think. I think by the time you leave fifth year, you might not know it, but you really have gained the skills that you need. Fine, you might be a little bit rusty with ABGs or whatever, and you might need a bit of practice, but it's all there. All those building blocks are there. And really, the first few weeks are just about getting settled in. And as much of it is actually moving to a new place. Actually, I'd never lived in London. I had never, had to work in that environment before. I was used to training in hospitals I was comfortable in as a junior. It's like, well, I don't know how to bleep. I don't know what the number is. I don't know where the front entrance is. I don't know where the cafe is. So the first few weeks are just settling in, really, and just getting used to it. But you're all in the same boat. When you start as an F1, there are, 20, 30, 40 other F1s, whatever the number is, in the same position as you, and you'll form such a good bond. And I think it's great. I loved it, to be fair. I loved those first few months, and I enjoyed my year as an F1.
Yeah, that's really good. We've got a lot of questions here about why you chose A&E. So A&E, about that.
Yeah, A&E. Some people think A&E is like super intense, and it's so stressful, and you can't have a life with it. And I think there's sometimes a lot of negativity around A&E. And yeah, A&E is a very busy job. And I work in a DGH. Lewisham is actually an incredibly busy hospital. We see a lot of patients every day as a busy South London hospital. But I love it because it's the variability of what you see. So, one day you'll see, in the same shift, you might see someone that's coming with an ankle fracture and you need to pull it, and then, later on you might see someone who's coming in with an acute MI. You might be dealing with a mental health issue, someone who's, got acute anxiety, or you might have a full-blown cardiac arrest and resus. It is an exciting environment to be in. And when you get more used to it, it's actually, there is a sense of calm with it as well. I know that might sound odd, but you do get used to it, like anything in life. And so even when things are going around, everything's going on around you, you get used to that, and you form an amazing team. I'm very close to all my consultants. I mean, I've been at Lewisham now for, I'll be going into my fourth or fifth year at Lewisham, and fifth year, and I absolutely love it there. Like, I've made friends with all consultants. Different people come and go, but you form great bonds, and you do it together. I think it's a brilliant career. If anyone enjoys that kind of fast pace, the idea that you can have acute interventions and really do things right now. Yesterday we had a good chest strain that we put in someone that came in with a spontaneous pneumothorax. I had someone with a laceration injuries yesterday that I put 20-something stitches in. It's a really hands-on, enjoyable job.
That's really good. Yeah. I'm sure that's useful to a lot of people considering a career in A&E.
Yeah.
Another question here. What's the most challenging shift you've been on in A&E?
Do you know what? I mean, the COVID time has been pretty tough. I mean, actually, winter is tough in A&E. I mean, we had it a few years ago at Lewisham where we had a particularly bad couple of days of the winter, and we were having two beds per resus bay. We were treating people in the corridors who were acutely unwell, and that's really challenging because then you're at a point where you're kind of juggling and trying to manage who in the queue you think is sicker, and you do that anyway, but it's an anxiety-inducing thing when that happens. It's rare, but when you're really like, wow, we are on the edge of managing this. COVID's been hard. When we were at kind of our worst, we were having so many blue light calls for people who come in with acute respiratory failure due to COVID, particularly at the start when we didn't really know what we were dealing with or what the right things were to do. I mean, when we first had a lot of patients coming in who were, really hypoxic and unwell with COVID, it was a little bit of a guessing game, for honest, about what would work. We'd use core principles, what we think would work. But the idea, I mean, from Italy, there was a lot of talk about early intubation so just basically not leaving people too late. And actually what we found is intubating not late, but leaving it as long as possible and putting them on, CPAP and putting them on their fronts was much better than intubating. So we were, as you can see, we were learning as we went along, and that was really challenging because there's no kind of handbook of what to do. And some days we really were intubating so many patients. It was difficult, but a learning experience for sure. Yeah.
Do you have a takeaway for everyone on how you coped working on the front line?
I think, in A&E and in any job, it's not just A&E, I shouldn't say that, in any job within the hospital at all, whether it's surgery, whether it's obs and gynae, whether you're working in the GP setting, you'll always see difficult things and have days where you go, wow, that was really tough. We made a diagnosis that was, you told someone that they've got cancer or something. It is tough. And I think speaking with people is so vital for your own mental health. Share, obviously confidentiality, but share in a confidential way what you've experienced, and you'll find that you'll find comfort in that, and people will be able to say, look, I experienced this, have you thought about this? And you don't feel so, it just makes you feel so much better. One of the things that I've tried to do is get wellness rooms in A&Es across the country. We've done quite a few so far. Lewisham has one, and the wellness room is literally a space that was a cupboard. It's slightly bigger than a cupboard, and we put some couches in there with a drinks cabinet with just like water and whatever. And it's a low lit room, not like clinical lights. And if we have a really difficult case or someone's really upset by it, they can go in there either on their own or with a colleague and talk about what they've experienced. I think that's really important. Not just as doctors, we're terrible at going, that was really awful as a traumatic cardiac arrest, let's just push that down and move on to the next. But that's just storing up problems for ourselves. So make sure you look after yourself throughout as well.
Yeah, that's really important. Yeah. So obviously you've got loads of platforms that you're active on. A lot of questions here about how you balance that while also working as an A&E doctor. How do you manage that?
Yeah, so that's the first thing to say is, I mean, I did my F1, F2, then I was a junior clinical fellow in A&E, and towards the end of that year, I was approached by Love Island to say, look, do you want to go on the show? And I said no for absolutely ages. And it's actually my consultant, who's still most of my reg at the time, is now my consultant, who is actually one of the most amazing doctors I've ever worked with. She basically forced me on the show. She's like, I'm the biggest fan of the show. You have to go on. I was like, I really don't want to. So I blame her for making me go on the show. And I didn't expect. I thought I'd be in there for a week or so, and I said, and I'll be back in A&E and getting on with it. But they didn't really realize how big the show would be. I think our year really kind of blew up. And it was an amazing experience. I think a lot of time, and one thing I'd say to people is, and I say this carefully, but do in life, challenge yourself in life, do things, put yourself out there and try different things. I think sometimes, and I want to be very careful, I think sometimes medicine can be a little bit like don't do that, don't do this, very hierarchical, you got to do this, this, and this, and don't swerve away. I've met some incredible doctors along the way who've gone and done some, I'm not saying like gone on Love Island, but gone and done some completely different kind of things. They've gone and done a music degree, or they've gone and worked abroad in a sanctuary or whatever abroad, and then come back to medicine and continue. Don't feel that you can't go and do things. So, I came off the show and I thought, well, I've got this platform. What am I going to do with it? I'm not really into selling clothes or club PAs. I thought, well, let's try and do something helpful. And because of my experience in medical school, where I felt I was struggling, I thought, well, actually, why not? Let's try and do our best around mental health and try and advise young people and try and be, I hope, a positive role model. So, so that was kind of my plan, and that's why I started the Waiting Room podcast, which we talk about a lot of health issues. It can be ranging from acne to mental health, and I've got different experts that come on each week, which is great. And my other channels and stuff as well, I hope that I promote some element of positivity. And as I say, one of the biggest things for me, and I say to people, and not just med students, but everyone in their life, is enjoy your life. Make the most of each moment as best as you can. Don't always rush on to that next step. When you're an ST3, you don't need to rush to be an ST4 or an ST5. Like, honestly, it will all happen so quickly, and before you know it, you're looking back on life. So enjoy it. And one thing I would say as well, because I'm sure people have mentioned this, I think it has been mentioned in the chat as well, concerns about things like GMC and stuff like that. There's no blueprint for going on a show like that and coming off, and there's no blueprint. But ultimately, I never did anything that A, would be ashamed of, B, that would be unprofessional. And if anything, I think it's reasonable for me to say that thanks to that platform, I've been able to do a lot of positive things, and I'm not someone to talk, I'm not patting myself on the back, but I think there's been some positivity from it. So always be professional, always think about your role and being professional as a doctor, but don't let that stop you from doing some amazing things and enjoying your life and experiencing different things, because you never know where that will lead and what positivity comes from it.
Agreed, 100% agreed. Really important point there. And speaking of professionalism, I have a question here from Roham Karimi. She said, says, hi, Alex. My question refers to your presence on TV, specifically Love Island. Did you have to request permission or get it pre-approved by the GMC before you did that?
Hi, everyone. Thanks for your question. I think it's a good one. Again, it kind of goes back to people's anxieties, I guess. Actually, I didn't speak to the GMC. I spoke to the BMA about it for some advice. And, the kind of end result was, I'm not doing anything that either puts my profession to just disrepute. It's not an issue in itself. At the end of the day, we all, I imagine a lot of us have dating lives and relationships and stuff like that. It's not something that's new or different to the patients that you see in the room. Of course, when I was on there, I behaved differently. I certainly wasn't intimate on TV. I was very aware that I needed to be professional as a doctor. That doesn't mean I couldn't have fun, I couldn't laugh, I couldn't wear stupid outfits and whatever, because that doesn't stop you being a good doctor. It doesn't stop you being an excellent doctor. And some of the best doctors I've worked with, again, are very flamboyant. They come in with socks that don't match and all this kind of stuff. I think the traditional idea of what a doctor should be is changing and should change, because it includes more people, and it doesn't have to be a really restrictive career. It can be, you can do all sorts. And I think people should be less afraid, not more afraid. It's the same with TV now. I mean, it's the idea of like, are you worried about when you're on TV? When you talk about things, I'm like, well, first of all, I never go on TV and talk about things that are expert areas or things that are, not within my field of things to talk about. And secondly, I try and see it in a way that if I can go on TV and positively influence one person or say something that helps one person, then surely that's worthwhile. And ultimately, you can only do your best in life. And I'd rather go out there, do my best, than I would shy away from things.
Yeah, definitely. And while you were on the show, did you ever have to be a doctor first and not just an islander?
Do you know what? So they had a health, they had paramedics there, and I think they had a doctor there as well, who was there for them to go and see. They always come to me and ask me questions. I'm like, no, that's not my job. I'm not doing that here. I constantly stand up. Occasionally, I'd say, look, you're not wasting anyone's time with that. Leave that alone. You're fine. But it wasn't my role on the show, and it was important that I sent them in the right direction. But someone did actually get quite a bad infection that I kind of saw, and I was like, you need to actually go and see them about that. Don't ignore that. So, they're all trying. There's more they were trying to get like really in depth, like teaching and advice about stuff. And I was like, I'm trying to have a couple of weeks off.
No, But yeah, that's really useful. We've got a really interesting question here. Has Love Island changed your perspective on medicine?
That's a really good question, isn't it? I think, do you know what it, I think it changed I might answer in two parts. I think it's changed some of my perspectives in some ways in life. I think, number one, I think, and this is particularly, I think, relevant to people starting med school now, you have far more similarities with people than differences. You might put yourself in a room with people and think, how am I going to make friends here or whatever? But I guarantee you, if you give it time, you'll find far more connecting features than you will differences. So that's first thing. And that really, I did learn that. I think particularly I've got some friends from that show for life who I'd never thought I'd mix with necessarily. And in terms of medicine, the one thing I do think, honestly, is that I hope that in some way encourage us to think that actually we can be doctors, but we can think outside the box. We can do things that are different. You can go away and experience something. I mean, people have hobbies and interests. There's no reason why you can't take time out of medicine to do other things. And, you know, I was terrified when I started med school. I was like, I must get through straight into F1, F2. I must get into core training. You know, I'm still a clinical fellow and I've been doing it for several years. I'm not in a rush to go anywhere. I'm still learning every day. I'm able to do lots of things. I do my podcasts and other things, I do my TV, you know, but relating that to everyone else as well, you guys can do anything you want to do. You know, you can do a lot more less than full-time working now, so you can balance. If you wanted to maybe teach a lot as well as being a doctor, you can do that. So that's the thing that I think it taught me, is that you can actually your life, you can tailor how you want to, and it's more important that you kind of enjoy your life, enjoy your career, rather than doing things because you feel you should have to.
Yeah, great takeaway there. Don't limit yourself. Yeah. So Alex, you're a BMA member, and we've got a question here. What's the best thing about being a BMA member, and how have they supported you?
Well, I think particularly we relate it back to med school, because I was a BMA member from kind of the start. I think it's the career advice, the support, and then the kind of the well-being support throughout was really important, because let's be completely honest, you know, medicine is quite hard. It's hard. It's stressful. We do a lot of exams. You see difficult things on your placements. I mean, I saw my first, I think, cardiac arrest like halfway through second year, and it really, really it shook me. And so I kind of used it to kind of hear about other people's experiences, the forums and advice, as well as the support there as well. So it is really helpful. And I think it's good to have a community, actually. It's really good to have a community of students and doctors that we all support each other.
Yeah, agreed. Got another question here about your career. Do you have any memorable moments, good or bad, from the early days?
The early days, I feel I'm still in the early days, but I hope. I'm turning 30, so I feel like maybe I'm not. Memorable moments. Actually, do you know, there was one really, really amazing one that I remember. This only happened like a couple of years ago, and I mean, I'd say in a confidential fashion, but I know the person wouldn't mind me sharing it. We had a gentleman who came into urgent care, so minors, who came in with some mild chest discomfort, but looked very well, had just been triaged, had an ECG, and the ECG was passed in front of me, and I was like, wow, like it was like a transforming MI on this ECG, and I was like, where is this patient? And I turned around, and this guy just literally turned grey and collapsed in our waiting room. So the consultant was with me as well, and we looked right quick, ran out, got him, put him on the trolley, ran him through into resus, and as we started, you know, we were doing CPR, and then we put the pads on him, and actually I don't know if he shocked him once or twice, but anyway, we got him back into having output, intubated him, quick call to King's, say we've got someone to send over PCI. He was sent over, had his PCI, and he walked out of hospital, I think like 4 or 5 days later. And it was one of the most like rewarding things, because it was one of those things we really, you know, if he was outside in the street, you know, as you guys know, it's the chance of survival is much lower. But we really, really felt that in that moment, we had an absolute definitive impact on his kind of survival. So you get to do amazing things. And I think medicine in that way, you know, is incredible. I had another, I'll be quick, so we're running on a little bit. You know, I worked in obs and gynae as an F2, loved it. If anyone gets a job on opportunity jobs and gynae, do it. It's brilliant. I was terrified at the start, but it was just an amazing thing to like deliver, and to be able to be involved in delivery of babies. I got involved in C-sections, and it was the most amazing experience. I still occasionally bump into people now who said, oh, you were involved in my C-section, you know, ages ago, and how's the little one, you know, going? So it is really rewarding.
That's really good. I just had a question about your career and how you balance that with your like other interests.
Yeah.
How do you manage that?
It's something I'm still learning. I think everyone has a busy life. We've all got so much stuff going on. We've got family to manage, friends. Some of us got children and things like that. So finding that balance is sometimes difficult. And what I've done basically, I work 2 days. I work 2 shifts a week, so 2 generally 10-hour shifts a week. When we had COVID times or the department's busier, I add on shifts and do more to support the kind of department. But essentially, I kind of split my life into different components. So I know that commonly on a Tuesday and Thursday, generally, not always, I'm in A&E. And then the other days of the week are free for me to kind of book out things or things I need to do. So maybe I want to record, like tomorrow morning, I need to record a YouTube video. In the morning, in the afternoon, I've got some another shoot to go to. And so I just kind of manage my time in that way. And I think we do that in med. We learn it from med school because you have to manage, you've got your lectures and when you've got your, I don't know, practical session and things. And I think it's the same. There's no reason why you can't. What I would say is that working full time, it's difficult to do that as a doctor. But I've got a huge amount of colleagues now who are in acute ACCS, they're on higher emergency medicine training, and they're doing less than full time. They do 60% banding, so work essentially 3 days a week. And the other 2 days, they do whatever they want. And there's no rush, and they're very happy. I've got actually a really good example. So I'm recording the 4th series of my podcast Waiting Room at the moment, and it's all around 9 episodes, 9 amazing stories. We've got David Knott on there, who's the war doctor. I'm sure a lot of you have heard of him. Read his book if you haven't, The War Doctor. We've also got one of my good friends, Marianne Nerono, who's a consultant now at Tommy's, and I worked with her for a few years. She has basically taken, she won't mind me saying this, she's turning 40 now, and she's taken all the way from graduating to 40 to become a consultant in emergency medicine. She's dual accredited as peds and adult medicine. But in that time, she's done MSF, she's traveled around the world, she's worked in Sudan, she's worked in parts of Pakistan, she's built hospitals abroad, she's done some of the most incredible stuff. And sometimes she goes away at 6 months at a time. She's like, oh, see you later, I'm off. And she's done amazing things. It hasn't hindered her. She's now probably a better consultant because she's worked in austere environments than she would have been before. So as I said before, the main message of what I say today is don't rush, enjoy each step. There's no rush to become a second year med student, or third year or fourth year or fifth year. You look back on your life and think, like even now, I would love to go back to first year for a couple of months. It'd be brilliant. I'd love it.
Yeah, we've got a really nice question here. Do hospitals make accommodations for doctors with health conditions like epilepsy?
I think much more now than, and again, this is probably not an area that I can necessarily fully comment on because if I don't necessarily have full understanding, but certainly from people that I know and friends, I think much more now than they would have done historically in the past, and they certainly should do. You should not, and I'm very passionate about this, you shouldn't be hindered in any way from physically or from any conditions physically or mentally. We're living in an age now where that's just not a thing anymore. And then what I would say again is make sure you do make these, make it known so that people understand, because then people generally, I find generally people want to help. They just need to know. So making people aware, whether at med school now, whether you're starting as a doctor, that you let people know so that they can help and see what they can do to support. But I was at F1 with someone who was using a wheelchair, and she was absolutely amazing, like a really, really good doctor, if not one of the best. And they made sure that there was kind of help and support to allow her to perform a job because she's a good doctor. The idea is to help people and support them.
I think it's so important that we support each other as well. When we do this. So one final question here. You've had a beautiful career and a bright future ahead of you. Would you do anything differently?
You're very kind, Rashab. There's definitely been ups and downs in my career. What would I do anything differently? I don't think I would, because there's some things, there's some things in life I might say yes, I would do differently, but I think you are the sum of your experiences in many ways, and so everything that has happened to me in my life has led me to this point. At the time, did I wish that I'd got my 2 marks in chemistry and gone straight to Liverpool Med School? Probably. But would I change that now? Absolutely not, because that taught me so many life lessons, even at that age, that helped me through med school. I made sure that I never let that happen to me again, because I learned the taste of kind of failure, if you like. And since working as an A&E doctor now, like I really, really enjoy it. I mean, I'm still personally trying to decide, whether I move forward into applying to higher training, like ST3, ST4 training, or whether I move across into the GP world. So I think I'm living each day, seeing how it goes, and I think that's a good way to be. I think life often dictates, or life often kind of pulls you in a certain path, and I kind of like to try and follow that.
Yeah. Thank you so much for joining us here today and taking time from your busy schedule. I'm sure our audience really appreciated your insight into a lot of these things.
No, thank you so much, Rashab. You've been a fantastic host, and I really appreciate you taking the time to ask me these questions as well. And thank you for everyone who sent questions in. Hazel Wallace, my friend, is on. She's the food mech on slightly later, I think just before 4. So make sure people tune into that. And my final message is just good luck. Like, there'll be ups and downs in med school. I had tears in med school. I had joy. I had everything. So just, don't be too hard on yourselves. Enjoy each moment. You will get through this pandemic. And I wish you all the luck.
Thank you so much, Alex.
Thank you.
Thank you. Yeah, thank you so much, Alex. I hope I can be half as compassionate a doctor as you are when I get there. And I know my brother hopes that I can have a similar collection of cars as well. On the subject that was raised around kind of health conditions and things like that, please bear in mind that your med school should be supporting you. If eligible, you should be getting disabled students allowance. I myself have ADHD. You're really not alone if you have alternative learning needs, and you should be being supported. To make sure that you get in touch if you're feeling like that's not happening, because we want to be there for you, and we want to make sure that patients are represented by doctors from all walks of life and with a huge variety of conditions, because I think that is really important that we have that variety.